That's what. And we'll be joining shortly by Chief Logan. And I think she's stuck in the traffic. Economy is growing, so the traffic is heavy. Dr. Daniel Vigo, and thank you for coming. And Dr. Daniel Vigo is BC's Chief Scientific Advisor for Psychiatric and Toxic Drugs and Concurrent Disorder. And we are also joined by Jennifer Duff, Chief Operating Officer of BC Mental Health and Substance Use Services. And thank you all for being here today as we mark a super important step forward in expanding the mental health and substance use care in Prince George and across northern BC. And to begin, it's my honor to invite Elder White to the podium to offer words of welcome.
Thank you. Hidi, Sundo. Basically, that's hi, how are you? Thank you for honoring our nation by respectfully requesting an opening and welcoming on our unceded ancestral territory. Lheidli believes in striving for your best, looking ahead to the future, only looking back for positive guidance. I'll tell you a little bit about our name, for those that don't know. Lheidli is confluence. T'enneh is many of. We've been referred to as Lheidli T'enneh, people of Tano T'enneh, and people a little to the north. We are indeed Lheidli T'enneh and have been here for many millennia, living with and within nature, flora and fauna, for food sustenance and medicinal healing, protecting and managing our lands, stewards of our territory. In the past, Lheidli, the confluence, was a place for the neighboring nations and other nations to come together and gather with Lheidli T'enneh. We would gather with the rigidness of business, the gentleness and joyfulness of celebration. I believe the essence of today is gentleness and joyfulness. Celebration. Celebrating the creation of a safe haven for healing journeys, a safe haven for rejuvenating and healing for many people of Prince George and surrounding areas, a safe vessel of a safe space, caring and dedicated people, and gentleness from the heart. It warms our hearts that you are here living within and with the spirit of Lheidli T'enneh First Nation. At this point, I would like to share a journey prayer, and I ask that you allow me to share these words with whomever you speak to in your time of need. Our Creator, forefathers, foremothers, thank you for safely bringing us together on this beautiful day. Hear our words of ask, of guidance, and our needs of gentleness as we each continue on our chosen journeys. As you have brought us all here safely, we ask that you guide the people here with a safe journey back to their communities. Snichalia, Masicho, all my relations. I am Lenora White, an elder of the Lheidli T'enneh First Nation. On behalf of our members, youngest to the eldest, our chief and council, we welcome you to the unceded ancestral territory of the Lheidli T'enneh First Nation. Awetsa, I'm done.
Thank you. Thank you, Elder Wife, for your meaningful welcome and honoring us with your kind words. We appreciate your generosity in welcoming us here today. Without further ado, I would like to invite Premier Eby to share more about today's announcement and what it means for people and family in this region. Thank you.
Thank you, Elder White, for the welcome to the territory. Very much appreciate it. And thank you, Mayor Yu, for being here and emceeing for us. It's great to see so many people out today. The last time I saw Mayor Yu, I was in Beijing. Let me tell you, people of Prince George, Mayor Yu was out there hustling. finding economic opportunities, job opportunities for the people of Prince George. It was great to see him there. He was there with the head of the Surrey Board of Trade and other local representatives to increase tourism and economic opportunities in the province. And I really appreciate that mutual support and cooperation. And thank you for leaning into your local knowledge. It was very helpful. This is a really important announcement for the province today. One of the big challenges, without a doubt, that we face in this province is the challenge of some of the most toxic, addictive drugs that we've ever seen, synthetic opioids, that are on our streets, that are killing people, that are injuring people, leaving them with irreparable brain injury. They're taking young people, taking people working in the construction industry, taking parents, children. It is horrific. And the need for us as a province, as a country, to grapple with this has not gone away. If anything, the urgency has gone up. I made a commitment on my election that we would do everything possible to turn the tide on this horrific scourge. And we have tried a lot of different things together. Some have been effective, some have not. One of the steps that I took as Premier was to reach out to a leader in the psychiatric community, working with a population of people struggling with serious mental health issues as well as addiction, Dr. Daniel Vigo, to ask for his assistance for a population that's particularly troubling for many British Columbians and for our existing system to deal with. People struggling with serious mental health issues, addiction to these incredibly toxic substances, often living in the streets, and as a result, often suffering brain injury that compromise their ability to make good decisions in community. They themselves exploited, unsafe, dying, getting injured, in and out of emergency rooms, jails, and then for others in community, anxious about relatives who are struggling this way, people that are loved, that family members want to see get support, who are not being met with the support that they need. And then others in community just looking and saying, what the heck is happening in downtown? Why do we see people struggling in this way in our streets? And so the question of how our system is going to accommodate this population is a pressing one and an urgent one. You'll remember, I guess it's been a number of months now, we announced the opening of beds within provincial prisons in Surrey, at the Surrey pretrial, at the Alouette women's prison, to respond to the fact that a lot of these folks are ending up in jail, to get them the support that they need. Those initiatives have already shown results. More than 60 people have been through, for example, the Surrey pretrial treatment center. We've seen dramatic improvements in workplace safety for people who work in the jail, safety for the inmates themselves, and better outcomes. So we're not releasing people who are actually worse off after being in prison back into the community, but people, in fact, who are stabilized and able to transition to community supports. The success of that initiative has led to the commitment to open involuntary care facilities, support for people in every region of the province. And today, I am very pleased to share with you that thanks to many of the people who are here today, and you can't see them, they're behind the cameras, but I see representatives of local government who advocated for this, Northern Health, First Nations Health Authority, PHSA, healthcare workers, because of the work of the people behind the camera here. We are having an announcement today, and I wanted to be here in Prince George, about a significant new facility here to serve the North. There are a couple of people I would like to call out specifically, though, who really assisted us in this journey. The first is Dr. Kane. Now, Dr. Kane does incredibly important work here in Prince George around mental health. And she and another very important person to this effort, Chief Dolleen Logan of the Lheidli T'enneh First Nation, had a couple of meetings that were crucial for the chief to be able to identify the opportunity and the need for this kind of service in Prince George, and for by extension me and through Dr. Vigo to understand how we can best serve the North. So I want to thank Dr. Kane for her efforts to this point and for advocating for increased capacity for mental health in the North. The second is I want to thank the Mayor and Council of Prince George. They have been relentless advocates for this kind of treatment support. And I would hesitate to call out any one member of council because all members of council have identified this need and pushed for this, the particular need for this in Prince George. But there's an individual here who's supposed to be on vacation with his partner today, and we had to change the date of the announcement. But it was crucial from his perspective to be here to see this through, and I want to thank Kyle Sampson for his advocacy on this piece. If there's someone on the other end of the phone about this mental health facility or about the helipad, it's Councillor Sampson. I want to thank him for his personal advocacy on this and apologize to his partner who is on vacation without him right now. In politics, we sometimes have a strange definition of fun. So today's announcement is a really positive one. It's an exciting one. It's a crucial one, and it's also reflective of an ongoing tragedy in our streets and the urgency with which we need to address it. Today, I'm pleased to announce that with the support of Dr. Vigo and the relevant health authorities, that we will be opening at this site a 70-bed involuntary care mental health facility to serve the people of the North. This facility will particularly focus on people who, because of their mental health issue, their serious addiction challenges, and too often a brain injury associated with that addiction, are unable to ask for help. And who need the opportunity to stabilize and then transition into a voluntary care system. We have seen this model at the Redfish Center of Healing in the Lower Mainland deliver remarkable results for people who many thought were beyond recovery, who were able to rebuild lives and show incredible outcomes. And we know that this can work. It will also address the suffering in our streets that has gone on unabated for too long. In addition to the 70 beds here in Prince George, today simultaneously in Surrey, the Minister of Health is announcing 60 beds at a former drug treatment facility in Surrey that will be providing the same care in the Lower Mainland as well. So today, 130 beds in the province in two different regions. The work isn't done. There are renovations that need to take place here. Hiring needs to take place to staff these facilities. But the contracting is already underway for the improvements that are necessary. And our goal is to have these open and fully operating in the next 18 to 24 months. This is an ongoing piece of work, and we are working with other regions in the province, including the Okanagan and Vancouver Island, to identify facilities and opportunities in those communities. Our goal is to find facilities like this one that don't require greenfield new build construction, but enable us to move a little bit faster because of the urgency of the crisis that we face. So once again, I'd like to thank everybody who was involved with this important announcement today. All of those people in our healthcare system that have worked with these folks who are struggling and who knew that a service was needed specifically for them, and who know that this will improve the quality of life and community for everybody, but most importantly, for those struggling with mental health and addiction issues, so that they can rebuild their lives in this beautiful province we call home. So thank you very much for joining us on this important day, and I look forward to opening this facility with you together as soon as possible. Thank you.
Thank you, Premier. I also like to, thank you, Premier, for recognizing there's a lot of people involved in this project. I recall September 16, 2026, Councillor Ron Paolo called me. He said, "You got to come to the city hall." We were at the UBCM, and that was a gathering of 14 or 15 mayors and the councilors. And in front of the podium, it was a sign said, "Standing together for urgent change." Less than 2 years, and now we have this facility open up. Premier, thank you for listening. Not only listen and act immediately, and this is an incredible cooperation between all your staff, your departments. I can just say, just not we here in the northern BC, thank you, but I think the people throughout the BC really appreciate this announcement. Thank you, Premier. For people and family in Prince George and the surrounding region, this announcement really represents a huge step forward to addressing the need of more specialized mental health and substance use services that is close to home. The key word is close to home. Northern community, we have unique needs, weather and expanding level of services, and these services will definitely help strengthen the support available for people that living around in this region. These new beds will definitely help to create more opportunity for people to receive care in their own community, in the backyards, and so we can have the support network and the culture that surrounding this area to make sure that people in need get their help. This is a meaningful progress and towards ensuring the northern community, as we grow, can access the service they need when they need it. And now I would like to welcome Dr. Danielle Vigo to the podium to give us a little bit more detail regarding this program. Thank you.
Thanks, everyone. Especially want to thank Chief Logan, without whom this would not have been possible. And of course, the Premier and the Premier's office and government, who have been decisive in putting this together in a very short period of time. I want to say that the main thing we know now is that finally, the tide is turning on the public health emergency provoked by synthetic drugs. During the past 2 years, we have significantly changed tack in how we approach the crisis. We have re-emphasized evidence-based treatment and recovery, restoring physicians' ability to use the Mental Health Act to treat children and adults with substance use disorders when they are mentally impaired. We have discontinued other approaches that had failed and instead created new services, such as secure approved homes, and mental health unit in corrections, which have been successful beyond expectations. For example, each person treated in an approved home is not only getting the right level of care, putting end to years, sometimes decades, of being locked up in a hospital room, but also ceases to block more than 2,000 bed days in average per person for services they neither require nor benefited from. This means that timely referrals to our first 18 approved home units free up 40,000 hospital bed days, and improved patient flow that benefits a minimum of 110 additional patients, who can in turn receive care in a timely manner. The impact of the mental health unit in corrections has been as remarkable. More than 50 of the most complex and behaviorally challenging patients in BC received timely psychiatric care, which has not only radically improved their own mental health and well-being, but also increased treatment compliance throughout the correctional population, transforming the everyday living conditions and safety of inmates and correction officers. Average time to psychiatric care was cut to nearly a tenth of what it was before, with use of force required only in a tenth of the cases. And today, I'm proud to confirm 132 new beds offering the full continuum of voluntary and involuntary services in northern BC and the Fraser Valley, with similar scale-ups in the works until the whole province is covered by the required levels of integrated mental health and substance use, hospital and community services. We start in Prince George because the vision is to turn northern BC, up to now one of the most underserved areas in the province with respect to this file, into an early model of what fully integrated mental health and substance use services could be. The full continuum of acute, long-term hospital beds for people with severe mental and substance use disorders, many with acquired brain injury caused by these drugs, approved homes to provide open-ended, secure housing for those with chronic mental impairment, and a crucial next step, developing the right mix of assertive community and housing services required so that when patients get well, they stay well. In order to achieve this transformation of the mental health and substance use system in a timely manner, substantial work remains to be done, especially breaking up silos and reversing the current fragmentation. I have delivered my recommendations as well as data behind them, outlining what is needed to develop a vertically and geographically integrated mental health and substance use system with full provincial coverage. I am confident that, with the unwavering leadership of Premier Eby, the encouraging signs we are seeing will be consolidated, scaled up, and become irreversible. Thank you.
Oh, you two then me.
Thank you, Dr. Vigo. Working to support some of the most vulnerable population is very difficult but necessary work. And thank you for your dedication. I remember countless conferences we attended as a council, as a mayors, and you have gave us all the important information that needed for us to advocate to the other levels of government, and I can see the result is here today. So now I would like to welcome Chief Logan of Lheidli T'enneh First Nation to podium to say a few words. Thank you.
Howdy. Sorry to be late. This is going to be my plug at Minister of Transportation and Highways. Please, 4-lane Prince George to Vanderhoof. It is so congested. So I thank everyone for being here. I see regional districts, the councillors, former Mayor Lynn Hall, good friend of mine, Premier Eby, Vigo, and our elder Lenore for starting us off in a great way. I want to thank the partners, the government representation, the healthcare professionals, and soon to be hopefully all full nurses. Just a little plug. This I get to do a personal plug here because my granddaughter starts nursing school in September, so she'll be becoming a registered nurse, and she will be staying here in Prince George. So when she's done school, so that's important too. So our healthcare professionals, Indigenous leaders, and everyone who has contributed into reaching this important milestone. It has come quick. It seems quick, but it's been a need that it's something we've always needed for many, many years. We've seen the facilities, and we've known for mental health and how much is, again, put on the nurses to deal with. Some of them have to go to deal with a person that they're not actually trained to do, I've heard. And this is something that First Nations has needed for a very long time, and all people from all walks of life is needed. This is, like Mary, you said, this is where we can get help at home. So we don't have to send our members or our friends or our family down to Vancouver or Victoria where they have no connection. And it takes a long time for a family member or friend to go visit when this is home healing, and I think this is going to be I think this is a great idea. I think this is going to be work for many, many years to come. So for the past several years, Lheidli T'enneh has been engaged with a meaningful discussion with Premier Eby and Dr. Vigo, provincial officials, and many others in the need for a different approach to Northern British Columbia. Throughout those conversations, our message has been consistent. Northern communities deserve access to the same specialized care and supports available elsewhere in the province. We appreciate having partners who are willing to listen, ask difficult questions, and continue working towards solutions. Every one of us has seen the devastation impacts of toxic drug crisis and the untreated mental illness. Families have watched loved ones deteriorate while desperately trying to find help. First responders, healthcare workers, outreach organizations, and Indigenous communities continue to carry an enormous burden. There are individuals who cycle repeatedly between emergency rooms, shelters, the justice system, and the streets because the care that they are truly need simply did not exist. Continue to do the same things while expecting different outcomes is not compassionate. It leaves people trapped in a crisis. We also have to acknowledge an uncomfortable reality. Indigenous people remain disproportionately presented among those experiencing homelessness, severe addictions, complex mental illness, and repeatedly interactions with emergency and justice systems. Those realities are rooted into generational of colonial policies, displacements, trauma, and inequitable health care. So we also stand to benefit. This facility is culturally. So there's going to be a space for cultural healing for everyone to come and acknowledge and to pray to whomever they pray to or who they need to talk to. Or it's smudging. Smudging's not for everybody. I myself, I really love the smell of it, but it makes me sneeze horribly. But but it's a cultural place, someplace comforting, someplace for an elder to come. Indigenous people really like elders to come and to hear and to talk. So they're like, I mentioned it to Todd this morning, community grandparents. If we have elders up here, and for those families that cannot come to visit their families, they know they have a community grandma or grandpa that's going to come visit them, talk to them, and just to listen. So this is a really important part of the healing journey, is to have a connection. So this is not about creating a separate system for Indigenous people. It's about ensuring the system exists that finally meets people where they are. Safe spaces mean safe communities. True safety is built when care and accountability exist together. Many people remember this property as a place connected to the youth detention and the painful experiences. Places carry stories, and not all those stories are positive. Today we have an opportunity to write a different story, a better story, a story of healing. That transformation reflects on reconciliation, what reconciliation should look like, not simply acknowledging the difficult history, but intentionally creating something better for future generations. Lheidli T'enneh is proud that these conversations happened with us, not simply around us. This is an example of government and Indigenous nations working together from the beginning, respecting one another's perspectives, and finding a common ground. This partnership has been essential to bring this project to the Lheidli T'enneh territory. Opening this facility is not a finish line. It is one important step within the much larger continuum of mental health, addiction treatments, recovery, housing, support, cultural supports, and community wellness. The success will be measured by lives stabilized, families reunited, and people finding hope where previously there seemed to be none. We owe it to those individuals and to future generations to continually build systems that is compassionate, evidence-based, culturally safe, and responsive to the realities of the northern communities. I want to thank Premier Eby, Dr. Vigo, provincial partners, Northern Health, healthcare professionals, and everyone who has worked tirelessly to this point. Most importantly, I want to acknowledge the individuals and the families who've lived experiences and remind us why this work matters. Together, we are taking an important step forward replacing crisis with care, trauma with healing, and hopelessness with opportunity. Masi. Thank you.
Thank you, Chief Dolleen, for being here today and sharing what this facility really means to your community and people, and for the opportunity you will provide to support healing, wellness, and recovery for all the people needs service here. I must say, together, as a council, city council, and you as chief, and your council, together we can achieve a lot together. And this is one of the evidence and we can do together. And of course, your bridge is on the way. And I apologize, the traffic must be heavy today. And we just joined in by Minister Spencer, who is responsible for this file. Next time, I'll make sure that we will clear up the highway when you guys arrive. And so I would like to take this moment to first invite Jennifer Duff to say a few words. And thank you.
Thank you. I'll keep my comments very brief. What could I possibly have to say after this amazing group of leaders behind me, the Premier, the Chief of the Lheidli T'enneh, Dr. Daniel Vigo, Elder Lenora, and now Spencer. So I'll keep my comments very brief. My name is Jennifer Duff. I'm the Chief Operating Officer for BC Mental Health and Substance Use Services, which is a program of the Provincial Health Services Authority. So me and team get the privilege of working alongside the many partners that have been named to operate this amazing facility behind us. I've also been a nurse for 25 years. I've worked as a registered nurse in many different parts of the system. I was trying to think of how to describe what I think this means for the community here in the north. 72 beds, more than doubles the current number of beds here in Prince George for mental health and substance use. So it's nothing short of awesome and meaningful in terms of investment. So really hold my hands up to government and the many partners that made this happen through their remarkable advocacy. Dr. Vigo talked a little bit about building a continuum. Many of the leaders behind me talked about a continuum. But what I wanted to speak to was patients, people with lived and living experience, and the families of those people who will experience care at this facility. And what we know, based on, as you heard from Dr. Daniel Vigo, is that recovery is a possibility. But we know that recovery takes time. And so that we know that just by putting more beds in the system, that doesn't necessarily solve the problems. And so it takes partnership, it takes longitudinal treatment and care, and it takes the continuum that has been described. So the beds that will exist in this building, as Dr. Vigo described, will be focused on the treatment of people living with concurrent disorders, severe and persistent mental health and substance use issues. A program and service that we call tertiary rehabilitation for people who need a more longitudinal path to their recovery. Transitional beds. We know that people aren't necessarily ready to return to community right after treatment. So we are offering a place to transition safely and appropriately. Also, long-term mental health beds. The length of stay for these beds can be up to 2 years and more because we know, due to the harmful impacts of the toxic drug crisis, people need a longer trajectory towards recovery. So this is a phenomenal investment in that recovery. Partnership has been mentioned by everybody, and I'm just going to highlight again a few partners and a couple that haven't been named. So the unwavering support of the respective Lheidli T'enneh Chief and Council have welcomed the PHSA with open arms to work alongside and to listen and learn with respect to the land that this facility is on. Northern Health Authority, your partnership has been tremendous, your leadership and commitment. First Nations Health Authority, your expertise and your commitment to walk alongside you and learn from you with respect to the 55 distinct First Nations of the Northern Health Authority. It's really an honor, and we look forward to that path and journey with you. Of course, the city and BC First Nations Justice Council. So the partnership has been unwavering. Dr. Barb Kane, you've been incredible. Your advocacy has just been remarkable, and you've been a great partner and a great advocate. And to all the clinicians here working in the Prince George community and Northern community, my hands go up to you and the work that you've done for many years. I did want to just reference a few things about the building behind me. It was built in the 1990s as a youth detention center. And Chief Logan did talk about creating a therapeutic healing space. And I really hold my hands up to government and their commitment to decolonizing the space and actually making it therapeutic and healing towards recovery. And so a great deal of effort and engagement to incorporate land-based healing mixed with Western medical model, what we know works at the Redfish Healing Center, is really a great commitment towards creating a culturally safe and appropriate place that's towards healing and not containment. And lastly, in our brief opportunity to engage thus far in this project, everybody that we've spoken to, whether it be the Lheidli T'enneh, First Nations Health Authority, Northern Health Authority, people with lived and living experience, everybody has asked us about access. How does my loved one, how does my family member, how do we access the facility that will be open here in a short period of time? And you have our unwavering commitment to work alongside the partners that I mentioned to make sure that we are transparent in how people access this service, that it is equitable, and that we don't create layers of bureaucracy to access these so essential services that the group behind me has described. So it's just a great honor to be here amongst such great leadership, and I'm so proud to be a public servant in government. I'm so proud to be a nurse, and I'm so proud of today's announcement. It's so exciting to build a provincial continuum for mental health and substance use treatment. So thank you.
Thank you, Jennifer. Supporting people with a complex mental health and substance use challenges is challenging, but important work that requires our compassion, collaboration, and most important, commitment. Thank you for continuing your effort and to strengthen the system of care and to close the gap. And I would like to take this moment also thank you all the nurses who worked tirelessly and all the volunteers. It's a very trying time, the last few years, as we as a council, we as a member of the community deal with some of the issues. This is just the first and many steps we will take to get the problem under control. There will be other facilities we may need in this area to help to address the mental health, homelessness piece. And so this will bring us to the end of today's event. And I will really thank you very much, Premier Eby. Thank you, Minister Spencer, for being here with us. And thank you, Elder White and Dr. Vigo, as Jennifer. And we are open for some question for the media. Thank you.
Thank you, Mayor. Thank you, everyone, for joining us here today in Prince George. We're going to take questions from the media now. All members of the media called upon will have one question and one follow-up. For media on the phone line, remember to press *1 to enter the queue and to unmute yourself when called upon. We're going to start here on site with Colin Slark from the Prince George Citizen.
Thank you. Your the media release issued by the government describes 60 beds being built in the facility that's already here, as well as 12 purpose-built beds. I was hoping that one of the people standing up the podium could describe the difference between those two types of beds and what they might be used for.
I'm going to pass this over to Dr. Daniel Vigo.
Thanks for that question. The purpose-built beds are the ones that are going to be approved homes, meaning secure, open-ended treatment environments, less like a hospital, more like a home in the community, such as the ones that already exist in Maple Ridge, the Spiritwood homes. And the other ones will be serving the continuum of care, as was mentioned here, for concurrent disorders, severe mental illness, in all the level of need.
And then as your government continues the rollout of these mental health and addiction services, what kind of reviews are going on to make sure that policies and procedures are where they need to be and adequately serving patients in terms of things like length of stay, how people get released, that kind of criteria?
Yeah, thanks. This standardization across the healthcare system was actually one of the reasons why I asked Dr. Vigo to take on the work that he has. One of the concerning early findings of his work for me was the inconsistent understanding of physicians and emergency room workers around when they had the authority to hold someone for treatment related to mental health when that person was also struggling with addiction. So maybe I'll invite Dr. Vigo up about just to share some insights about his work to ensure a consistent and integrated provincial system.
Thank you for that question too. As the Premier indicated, the shift in perspective that we have implemented in the past couple of years allows for clarity in physicians knowing when they can use the Mental Health Act to treat children and adults who require treatment but are unable to seek it out themselves. We developed 2 documents, one for adults, one for children, that are available online in the government's website for the Mental Health Act, and that explains how any physician or nurse practitioner can help the people in their moment of greatest need. The rollout of this has been ongoing. I have personally connected with thousands of people in the province. My phone is open and working overtime, I would say, helping with specific questions or specific challenges. And this increasing integration of the system is what will allow us to see how these changes reach the whole province, every ED, every GP, and every pediatrician in the province. Thanks.
Next, we'll head to Cheryl Jan with CKPG.
Thank you. Just a quick question. I'm not sure if it would be you, Mr. Eby, or Dr. Vigo. The question I had was, so if we have somebody who is subject to involuntary care, what, for want of a better word, criteria do they have to meet to be subject to that? And who makes that call?
Thanks, Cheryl. Yeah, I'll pass that over to Dr. Vigo.
The criteria for treating someone, even if they don't want to be treated, are clearly specified. For adults in Section 22 of the Mental Health Act, well, actually for everyone in Section 22, and then there's Section 20 that creates another additional possibility for children. The criteria are that the person has a mental disorder that is very severe and interferes with their relationship with others or with the environment, that puts that person at risk and puts others at risk because of that behavior, and there's a risk of serious mental or physical deterioration, and the person is unable to access services voluntarily because of the impairment. When those criteria are met, a person with any mental disorder, including substance use disorders, including neurocognitive disorders, which is very frequently because of the acquired brain injury, or neurodevelopmental disabilities, or any mental disorder, can be treated involuntarily by decision of a physician.
So that would be even a GP?
Exactly, yes. Any physician in any part of the province can exercise this authority to remove the final barrier to care. Because let's remember, it was frequently framed, this involuntary care, as a question of restriction of liberty. It's quite the opposite. When someone is impaired mentally for whatever reason, be it a physical illness, metabolic imbalance or sepsis or whatever, people are treated even if they want to go home and sleep. In fact, they can't because they are at risk. When the cause of that is a mental disorder, then the Mental Health Act provides with this life-saving and I would say rights-enabling form of care.
Last one, I swear. And I'm not sure who will answer this. This is a centre that will be dedicated for all of Northern BC. It's a big place. So are there, certain designated beds, certain number from this area, certain number from Prince George? Has that been determined yet?
Shall I take it? Again, those are operational decisions. We have the best people that will run this facility, Jen Duff, Vijay Sithapati, Barb Kane, the collaboration between PHSA and Northern Health, with a provincial lens, will allow us for each of these facilities, the one we're announcing here, the one we're also announcing today in Surrey, and the ones that will be announced in the future, they will all serve the province, of course, starting with the region. And the region, as was mentioned repeatedly, each region requires a decentralized set of beds that can help that the person is still integrated with their family, with their community, with their nation.
Next, we'll head to Zach with My Prince George Now.
Thank you very much. So my first question, what exactly is the plan for a facility like this one, especially when healthcare is in the midst of staffing issues?
Thanks. I'll take a bit of a swing at this and then pass it over to Dr. Vigo. One of the things that we've seen in terms of our healthcare recruitment drive is policies and initiatives put in place by the provincial government are attracting professionals to British Columbia to come and work here. We've had particular success with our American recruitment drive. For example, nurses over the last couple of years, we've added 5,600 nurses, added about 10% to the nursing population in the province. When I meet with those nurses, I talk with them. I had the opportunity in Nanaimo to engage with a number of American nurses who are coming up to think about coming to British Columbia. They know about our ratio program and our province's efforts to improve working conditions on the ground. Still lots of work to do, but showing promise in a number of regions. Our hope is that this initiative will work the same way in terms of recruiting the kinds of professionals we're looking for. Here is a new program from the ground up that you get to participate in the design of and in implementing that is addressing a chronic and serious social issue that is of deep concern to people across the province. That draws in professionals. What doesn't draw in professionals is the idea of meeting a patient and not being able to deliver the care that they need. And so right now, I've got to imagine it's hard to recruit mental health professionals to work in hospital, knowing that people are not going to get the care that they need. And so facilities like this will enable that integrated care system that will attract the professionals we're looking for. But I am not the expert in this area. I would turn to Dr. Vigo, who has conversations with these professionals about the question of staffing.
Staffing is a challenge, but as was mentioned by the Premier Eby, when the government works in lockstep and the adequate set of incentives is out there, we can get, like we're getting, a number of colleagues from, for example, the US. I think that type of targeted recruitment effort can be generalized across the system. And I think that when we start having a consistent, homogeneous approach to engagement and retention of key staff across health authorities with no inconsistencies, with no, let's say, without confusing what the priorities are, as we make that approach something that is appealing across adequately resourced settings such as this one and the others that are being created and the ones that exist such as Redfish, and with the adequate level of community care such as assertive community treatment teams and flexible assertive community treatment teams, that will generate want to work. Thanks.
And my last question, during construction and once this facility is officially opened, whose hands will this fall under? Will the province have a hand in this, or will it be a purely local run facility, essentially?
Maybe I'll turn that over to Jennifer, but first, the Ministry of Infrastructure within government is coordinating the contracting on the site here and the site in Surrey. They are responsible for contracting around renovations or new builds in the healthcare system. And then in terms of broad health authority oversight, Jennifer, you comfortable?
Thank you for the question. Yeah, it will be the Provincial Health Services Authority who will have accountability for operating the facility. As I referenced, though, we can't do it without great partners. So Northern Health Authority partnering in how we recruit and retain staff to the north has been referenced, working along First Nations Health Authority. Those partnerships are critical. We will need about 150 staff to operate this facility in a safe and appropriate way. And we have a mix of professionals. So nurses are so imperative to the healthcare system. I'm one of them, really proud to be. But we also need a number of allied health professionals to work in this model. We know at our facility in Redfish, which is located on the lands of the Coquitlam First Nation, what we colonially refer to as Coquitlam, we have relatively low overtime, a full staffing complement. We've created a really wonderful sense of culture and a real sense of magnet type of hospital environment. So I'm hopeful we can bring some of that learning here to the north in good partnership with the partners that I referenced. But it will be a concerted effort to recruit 150 professionals. We also have different ways of working now, thanks to, I think, COVID. We can work in a bit more of a virtual way, not in terms of hands-on, but sometimes if we need the consultative expertise of a particular clinician who's located in the Lower Mainland, we can do that a little bit more creatively now. Nevertheless, we will have to recruit clinicians to work physically in this environment. So yeah, really excited. I think we can do it. I know we can do it, and we will do it. And it will be really as an outcome of great partnership with the partners that I referenced.
Next, we'll head to Hannah with CPC.
Thank you. I've heard criticisms from people in the community that there's not enough voluntary care services, particularly in northern BC. So why the focus on involuntary care before those gaps in services have been addressed?
Thanks. It's an important question. I know the need for drug treatment for people in communities across the province is urgent. We've opened and will continue to open beds on the voluntary services side. The Road to Recovery initiative that we're expanding across the province is part of that work. Is showing very significant improvements. We've opened, I think we're getting close to 1,000 additional treatment beds in the province, driving down treatment wait times. But there are a population of people who, because of a combination of serious mental health issues, serious addiction issue, and often an acquired brain injury that comes from the drug use when they overdose but survive with a brain injury, whose needs are very intense and very particular and very unique. Those needs show up in the community like chaos in a downtown core. They show up in emergency rooms, causing disruption and creating safety issues for workers in emergency rooms. They show up in the justice system, in and out of jail, in contact with police. They show up in issues of disorder like arson and other safety issues for the broader community. And at the same time, those people are in very serious jeopardy of death. And so when you put those factors together, we have to do both at the same time. We can't wait until the full voluntary on-demand system is built out across the province without addressing this chronic issue in the community. And that's why you see us doing both right now.
Right. And we've been speaking about nursing as well during this announcement today. Linda Silas, Canadian Federation of Nurses Union's president, says, Premier Eby, I've been bragging about you across the country for the last 5 years. Now it is time to step up and speak for nurses, speak for patient care, and it has to be done now. Nurses are calling to get involved directly in their contract negotiations. How do you respond to that? What are your plans to address her concerns?
Well, you know, the reality is for British Columbians who've come into contact with the healthcare system, there's not one that hasn't had their life positively impacted by a nurse. Nurses are probably the most beloved people in terms of professions. I speak this as a lawyer, politician who married a registered nurse. I'm hoping some of it would rub off. You know, I'm always happy to speak in support of the amazing work the nurses do across our system. Nurses are the glue that holds an incredibly strained system together, and they deserve to be recognized for that. There's no question about it. The current labor disruption, the job action by nurses to draw attention to their concerns about conditions of work, around safety, around the demands that are put on nurses every single day. Those are real. Our government has been putting in place pieces to address those, making sure that there's a enforceable ratio of patients per nurse, so that a nurse doesn't feel that patients aren't getting the care that they need. Work around improving security, including pilots related to security screening and new relational security guards in hospitals across the province. Today's announcement is part of improving safety in emergency rooms for nurses as well. But there are issues that need to be addressed. The Minister of Labour will be making an announcement later today about a mediator to assist us in these conversations. The goal, I'm sure, on all sides is to get the nurses back to work as soon as possible. And also at the same time, I want to express my appreciation for the efforts that they make every day for patients.
Next, we're going to head to the phone lines with Wolfgang Deppner from the Canadian Press. Go ahead, Wolf.
Yeah, hi. Good morning, everyone. Premier, thank you for taking my question. You've already you've taken away one of my questions. I was going to ask you when you were going to send out the bad signal for Vince Reddy, but it seems like the government has already done that.
Somehow I have a feeling you'll come up with another question, Wolf.
Okay, sounds good. I shall actually. Question regarding the condo bailout. Andy Yan has written an interesting column in Maclean's magazine recently, and he has made the argument that government, instead of supporting condo developers, should be buying up some of these condos and then turn them into sort of the seed or sort of the starting points for more community housing. What, if any, plans does your government have to potentially do that? Thank you.
Well, I mean, what an unusual way to talk about what we're doing. First of all, we haven't released the program yet. So I would encourage everyone, including Mr. Yan, to wait for us to announce what the actual details are or what we're proposing. The program is animated by the fact that we can currently, we believe, buy housing at below the cost of construction. This is not support for developers. This is support for people who are looking for housing. If we start new, build construction today to build housing, including the kind that Mr. Yan is advocating for, we are talking 3 to 5 years to opening, and spending significantly more than we would spend to buy units that are available in the province. So it may be, in fact, that Mr. Yan is advocating for us to buy units to do exactly what we're going to do with them. So I would just ask for the opportunity for us to announce the program, share the details before people announce that they don't support the program and would like us to do something else.
Do you have a follow-up, Wolfgang?
Yes, I do. Thank you. I'll double barrel this one. When can we expect to see specific details? And obviously today's announcement happens in Prince George. You'll be spending time up in the northern parts of British Columbia. Can you sort of contextualize today's announcement regarding involuntary care facilities with some of the larger goals that your government is pursuing in British Columbia and in northern British Columbia? I speak specifically about some of the energy projects. How does sort of today's appearance sort of fit into this larger agenda for northern British Columbia, including energy issues? Thank you.
Thanks, Wolf. Interesting question. I think that the reality is that the economic growth that we are expecting to see in the province is indeed concentrated in northern and rural communities across British Columbia, and particularly in the north. It's been the reality in the northeast for quite some time, and the northwest is showing remarkable growth right now. And so what we expect to see is increased pressure on critical infrastructure, everything from housing to pipes to power, you name it. And the virtuous cycle of supporting northern communities with infrastructure like the North Coast Transmission Line, like the community benefits agreement that we struck with the Northwest, where we supported communities with money for infrastructure, like the recent federal government announcement of additional money for communities facing significant economic pressure due to growth. The virtuous cycle of that is it's improving the quality of life in communities where we know people need to be not just recruited, but retained to stay in those communities for the long term. And I'll take it one step further. Part of that means a vibrant downtown. Part of that means a community you feel safe in, walking around with your kids. And bluntly, there are a population of people who are hugely struggling in the streets visibly right now that need intensive care and support themselves, that will also support communities in being more livable if they're looked after properly. And so creating livable, vibrant communities in the north, not just for the booms and busts of various resource job swings, but for the long term, including long-term sustainability of these communities. This is work that we have to do.
Next, we'll head to Ben O'Hara-Byrne from Global News. Go ahead, Ben.
Thank you both. Hello to Mayor Yu, who wants to entertain a 8-minute conversation with me about Mr. TG. So hello to you. These are questions, though, for the Premier. First of all, about the nurses. Can a mediator really work the kind of magic? We understand you're far apart on salary, there are fiscal constraints, the province is under. How much of a miracle can the mediator work here?
Yeah, I don't want to prejudge any conversations that will take place at the table. I know that we have a shared goal of ensuring nurses are respected and appreciated in our system and are able to return to work fully to support patients in British Columbia, and that'll be our goal at the table.
The Tsleil-Waututh, on another topic, have now launched a court challenge to try to stop the dredging of the Second Narrows shipping channel. I know it's a federal thing, but how much, first, a reaction to it, and how much is consultation going to be an issue, you think, when it comes to, in fact, getting some of these other projects done, including essentially upping tanker traffic in that area with both expanding TMX and maybe even a new pipeline?
Well, I have confidence that the federal government will be able to work with Tsleil-Waututh First Nation and address their concerns. And as a specific component of the MOU, we negotiated with the federal government for projects that are federal. The Prime Minister committed that the federal government would work with First Nations. We don't want those relationships that we rely on for a number of different projects compromised by federal initiatives, and neither does the Prime Minister. So that commitment has been made. I have confidence they'll be able to work things out. Everyone understands the importance of this work, and I am grateful to have a federal partner that's committed to this work, as well as First Nations partners across the province that are equally committed.
We have time for one more question, and we're going to head to Alec Lazenby from the Vancouver Sun. Go ahead, Alec.
Premier, I just wanted to ask, I think you mentioned a number of how many people have gone through the Surrey Pre-Trial Centre. Just wondering if you have an update about the number of patients who have gone through Surrey Pre-Trial and Alouette, and sort of where those facilities are at in terms of outcomes for people who are experiencing those services.
You know, I was going to look it up in my notes, and then I realized I've got the guy right behind me. I'm just going to pass this over to Dr. Vigo.
So around 60 patients, but again, that is an evolving number because the treatment is delivered the moment the patient needs it. Was there the outcomes? Well, the outcomes have been phenomenal, and we have seen that personally. The visits that I've made to the center, I've seen the same people before and after the treatment was delivered, and I won't give details because of course confidentiality issues, but the transformation is so radical. Imagine, it's people that before that center opened, when they required psychiatric care, they were put in segregation, but were not given psychiatric care because the Mental Health Act didn't allow it. So what we did by making or creating a mental health unit there is facilitate the timely care of those patients. So we reduce the wait time to receive psychiatric care in isolation to 1/10 of what it was. And again, because there was a concern, and it is important for people to know that these are not folks that are being brought there from the streets, etc., to be treated. No, these are folks who already, because of the challenging nature of their behaviors, they're already in prison. They have their severe mental illnesses, substance use disorders, require treatment, and now they can receive it in the moment, stabilize, improve not only their symptoms, but their quality of life. And the most remarkable impact has happened in the whole correctional population. The compliance with treatment indications has improved, even in the patients that are not part of that mental health unit. The safety of the environment has completely transformed. The working conditions there, all types of violent episodes have decreased, especially the correctional officers are much more safe and the inmates are much more safe. So I would say that the most important outcomes are now they get timely care, reducing 10 times the wait times. Violence, meaning the use of force in order to provide that care, has not been an issue. It's only a minority of people who require to be physically contained to receive that care, 1 in 10. And the environment, living conditions, quality of life have improved.
And Alec, do you have a follow-up?
Yes, I do. I want to ask if you have similar numbers around Alouette and based on my previous question. And then my second question was, Dr. Vigo, I know you said that we have seen the benefits of some of the change in tact maybe that the province has done around dealing with mental health and addictions in terms of the lowering deaths. But I don't know whether the Premier or Dr. Vigo wants to answer this, but the lowering death rate seems to be a North American-wide phenomenon, not concentrated just here in BC. And you've got lots of advocates who say that, in fact, things like safe supply or other harm reduction measures would actually help improve some of those numbers. So just wanted your thoughts on whether this could be attributed to specifically BC in terms of the lowering death rates, or whether it's, part of a broader North American phenomena that, the reasons for it are more spread out.
Yeah. So there's several factors. This is a very complex situation where supply side issues, meaning the availability of precursors and of synthetic drugs, have changed. The way that the dealers bring those drugs or produce them locally has changed, and it is difficult to know how much of the change is produced by that and how much of the change is produced by the change of TAC. Now, what I can say is that the improvement has not been homogeneous all over Canada, for example. In some provinces, it's getting worse. The provinces where it's getting better, it's important to note that are provinces that are changing TAC in the way that we're approaching the issue. But again, we cannot causally attribute the improvement. What we can certainly do is ensure that we put all our efforts in maximizing those evidence-based treatment that allow people to stay free of drugs, that allow people to stay in recovery. And of course, we will maintain those harm reduction measures that have shown to be effective. The distribution of naloxone kits, for example, has been proven effective, and we have discontinued the ones that did not have evidence of effectiveness. And so I think that our goal in this context of an improving statistic with respect to overdose death, non-fatal overdoses, acquired brain injury, is to continue focusing on evidence-based care, including that needs to be delivered involuntarily when the person is unable to seek it themselves.
Thank you very much, everyone. That concludes today's event.